Minimalism and medicine. I'll tell you, minimalism, one of my favorite philosophies. It's something that I have always appreciated, really appreciate. So when we think of minimalism, where it's most often brought in is like into decorating, into how we're organizing our house. If you look up minimalism online, you'll see podcasts about getting the clutter out and simplifying everything. And simple fasting, to me, what I'm trying to do on this channel through my work in medicine is help us to simplify our life in our metabolism, our metabolic health, actually in the body. So what I like to say is that fasting is minimalism in the body. So we can take the concepts of minimalism, bring them in both to health, our life, and then medicine more broadly. So going to take a look at that. Today, real happy to have you with me. Throw your thoughts and reflections as we go along into the comments, and we can have a discussion about it as we go, and especially at the end. So minimalism in medicine, we are, I would say, in many ways, in a maximalist medical system. We're about as far away from minimalism as perhaps we have ever been. And then there's parts of that are good and bad. Of course, we are in the midst of an incredible explosion of technology and development and things, and there are good sides to that. But today we're going to look at the other side of it also. How do we need as little as possible? Minimalism certainly isn't about having no possessions or no things. It's just about having the best things, things of true value and importance. And of course, this is what we really want in medicine for sure. A couple quotes on minimalism to center our thinking and bringing it in. This from Connie Bisalski. Less is more. Less is better. It enables you to be less distracted from what's really important to you in life. It creates space. So when you get rid of the clutter, all the things that are not essential, what remains is what really matters. And this is what we want. What really matters in medicine, and how do we deliver medicine in a way that is the most effective, like a razor sharpening, just the things that are of great value. Here's another one, Hans Hoffman. The ability to simplify means to eliminate the unnecessary so that the necessary may speak. Isn't that beautiful? So to me, these are very centering thoughts for a fasting space, for the type of thing that we are trying to do in our body and in health, and then taking it more broadly into the broader experience that we're having in medicine. So to me, when I think of minimalism in medicine, I think of this centering phrase, first, do no harm. To me, this is like the minimalist maxim in medicine. First, do no harm. So I was doing a lot of thinking as I was preparing for this discussion. I was thinking, does anybody not agree with this? And it turns out that this wonderful doctor who wrote this article does not agree. And so I like always to challenge thinking. And so I was thinking, should we challenge the idea of first do no harm? And so this doctor is an orthopedic surgeon. And so I kind of get a smile on my face thinking about their perspective. Think about the life of a surgeon. Okay, what is the first thing they do? They cut into people. And that obviously is some amount of harm. And so oftentimes you say the first thing they're doing is causing some harm. The proposal that this doctor makes is that we need to replace first do no harm with harm appropriately. And I laughed while I watched this paper. I put this paper as a reference, so you can read it if you want their perspective. I completely disagree with it, actually, like in a big picture. But I love the perspective of thinking, from a surgeon saying, okay, some amount of harm going to happen. We're going to go in to get the infection out. The big picture that I have is that we need to zoom out. First, do no harm to me does not mean we can't do a surgery. It does not mean that there can't be risk or that something can't happen. Medicine is always a discussion about risk everywhere. And the point that they make in here that I really like is there's risk in delaying. And certainly in an emergency, first doing no harm is like, don't delay. If seconds count, okay, don't harm someone by dithering around and doing 20 things. To me, this is, do what has to be done. To me, this is not incompatible. First, do no harm, I think, is very applicable to surgery and in emergency, just like it is in the rest of healthcare. If we get right into the emergency settings, seconds matter, okay? First, do no harm, to me, says, okay, if seconds matter, there should be a millisecond thought, just a millisecond about, is this the right thing to do? And the scenario that was coming to my mind is like, is this patient 90 years old? Do they have a special bracelet where they have said, I have a living will, I have an advanced directive, I don't want to be resuscitated, I want the end of my life to be, let me go peacefully, please. If someone has communicated that and you don't take a millisecond, I've seen this happen in medicine, and all of a sudden people are getting put on ventilators and CPR and things that we don't want. These emergency situations can actually harm people, and we can disrespect people's wishes. So even in the emergency, we want to think, first do no harm, take the millisecond, and then, like, if it really is the appropriate thing to do, of course, do all the things, have the surgeries, be maximally intense. But first do no harm, I think, even in this scenario. But when we take it out of the emergency situation, then it becomes even more clear. We need a centering principle in medicine that starts from a grounded place where we don't hurt people. So much hurting of people happens in medicine, everyone aware, and they point out in this article too, okay, medical errors a part of it. But I'll tell you, a way to get way upstream of medical errors, which is such a huge problem and a huge process, is to stop doing so many things to people, I will tell you, as a first principle. So I really love it. So after really challenging myself with articles saying, no, we should focus on appropriately harming people, I say no. Medicine is first do no harm. It is a tried and true grounded philosophy, and it remains the core philosophy of what I think medicine really should be founded on. Doing as few things as necessary is going to help us protect people from ourselves, because, they told me in medical school, they say 50% of what we're teaching you is wrong. We just don't know what 50%, okay? And it's probably more than that, all right? So to me, a minimalist philosophy is like starting at a very grounded and humble space and really being thoughtful. So not that we can never do anything, but that we are bringing so much care and thoughtfulness and intention to it. Okay, so that's like some big philosophy to start. Here's just a little anecdote from my experience when I was working at the VA hospital way back in the day, okay, 2000s. And this episode happened, do you remember? This is just one tiny example. Ranbaxy Corporation, one of the largest generic pharmaceutical manufacturers, was producing generic Lipitor, atorvastatin, and their process was broken for years. Their machines were putting glass shards into the pills. And then I had some patients who were getting these and had them recalled. And so for years, people eating micro glass shards, and they had paid huge fines and all of this thing. So to me, this is always highlighted. How many people were harmed by it? There's many lawsuits, and people say, oh, people weren't really harmed. But to me, it always just was a thing. I was a very young doctor. I was like, oh, I'm prescribing things to people. Like, oh, this is just what we do. The things are going out. All of a sudden, I'm filling people up with micro glass shards in it. It always was framing to me. There can be bigger things going on that we do not completely understand. And I was like, oh, isn't it the case that if we were minimizing some of this, what if, not that anyone should ever not take something that they need and could help them, but what if we were getting to a level where someone didn't need it? Like, obviously they would be healthy, but then it would be protecting people from things like this. So this has been a minimalist thought that has stuck with me in medicine for quite a long time. Can we design processes and systems to help people be insulated from gigantic industrial manufacturing accidents that are poisoning people, for example? Like, would be great. It would be great. Okay, so how do we do that? This is what we're going to try to dive in. It's like promoting health. This is the very foundation to me of healthcare. And it's like what becomes healthcare and what just becomes life and a healthy life. Like all this we see, it just merges together. But promoting health should be the bedrock practice, certainly of healthcare. And if it's beyond healthcare, it certainly is. But when we think about a multi-trillion-dollar healthcare system, almost the entire focus, practically, is on treating disease when it has reached an advanced stage. And we have very little, precious little actual financial resources that are in this space. And it's kind of, and if that's how it is, it's how it is. And we don't have to complain about it. We can take control of it ourselves in our own life. And this is the thing. I want this to be really empowering. We don't have to get overwhelmed or frustrated about politics and economics, health system, and all these things. We can just observe it, and we can see the focus of this place is on treating disease in an advanced stage, and we want to get way upstream. That's what I want to say. The minimalist perspective, bring it into our life, and probably the way we backdoor into medicine is that when we have systems and thoughts and ways of being in the world that are healthier and keep people healthy, people just going to need to interact with the health system a lot less. And that's going to help everybody. And it's going to help people in the health system who are overworked. And it's going to leave more resources for people who really need it at that time. So I say all of a sudden, what is the healthcare system grows much bigger. And to me, like, just like when I'm talking about a fasting space, I'm also talking about eating healthfully. Like, I can't separate those two in my mind as just two sides of the same coin. To me, I look at it, I say agriculture is the health system. And when we look at our country, I don't think we can look at the way the state of health is and say that our food system and the healthcare system are also two sides of the same coin, It's like we are what we eat, what we are bringing into our bodies, both the good and the bad, is one of the most major manifestations of health. So if we want to really get upstream, like we gotta look in these types of directions, and then we see the culture too, right? That the culture, the mental space, when we think about all the things that bring wellness to the body, so much of it exists outside of the healthcare system as classically defined. So when we're looking at ways to make processes to minimize the amount of things that we have to do to people, the problem isn't just, a doctor's office and a government program and Medicare and, all these things that we classically think of as healthcare. It's like we got to think much bigger, in my view. And I just have this point. I say everything matters. I really believe that. I did the conversation back in the fall, everything matters. In health, and it really does. And so let's dial in on that. All right. If the number one problem in our healthcare system, which I say it is, the number one problem in health, the health for people, is metabolic dysfunction, which means our metabolism, the way the body is running, is not optimized, and it's because the environment that the body is placed in is not the environment that it was created for, designed for, that it is trying to operate in. And to me, we have so many thoughts in our health system and society that the problems that we have are genetic disorders and really, I think we need to look at the environment that we have, and we see that it's not a healthy environment. And the process of promoting health and bringing it into a space thoughtfully is a space of designing environments that can help the human body to flourish. When we have a broader system in which the human body is flourishing, will not be experiencing metabolic dysfunction, the amount of these downstream processes is going to be less. So you look at this list, I just typed this up as I was making the slide of things that are downstream and interrelated with metabolic dysfunction. So I'm not saying that, a fasting process, we're just going to have everybody in the country going to start fasting and all these will disappear. I'm not saying anything. There's no panacea, but what I am saying is that fasting is one component, absolutely, of a process that can help all of these things. And if we are going to try to minimize, I would say the catastrophic impact of so many of these conditions on our society, it should just be in the discussion. This is the type of discussion that I'm wanting to lead and have with people. You look at the top one, cardiovascular disease, leading killer of people, in the country. It's such a profound space to get an autophagy effect, to clear out excess and help to improve this system. Things from the top all the way to the bottom, abdominal complaints. I could just, and I have, and I will continue to give talks on all these things. How many people that I've worked with suffering from acid reflux, how many proton pump inhibitor prescriptions am I able to stop when people actually give some rest to the GI system? So here's just to take one disease like acid reflux and say it's not everything, but a huge amount of healing and health can come from opening up a fasting space, getting in a cycle with it where we teach the body we don't need acid here all the time, especially at night. People with severe reflux have to sleep with the bed tipped up so that they're not refluxing. Is okay, you start fasting in the evening, you shut down all the acid production. Do you see how that's bringing minimalism into things on many levels? Minimizing the acid production, minimizing the meals, minimizing the space where the digestive system has to work, minimizing medications. All of a sudden the cost of things going way down, and there are so many second order effects from it, like the development of Barrett's and risk for esophageal cancer. So it's just huge. So we could take 4 hours and go through examples on every one of these lists of ways that minimalism and then a fasting-based minimalist process can come into this space. But we're just going to focus on one for keeping things here. After I've already done a bonus one when I got talking about GERD, okay? And all this is to say, I want the standard approach in medicine of technologizing our way out of all it. I want that to continue. I want it to be clear. If I'm not opposed to developing new drugs and using every type of technology and actual medicine, pills to fix any of these problems. I want new and better. Everything is good. If I didn't believe in any of that, I would just be sitting out in a field with my goats, like that session we did the other day, and I'd say I'd disconnect. But instead, I've built a video studio in my house. The amount of technology that I'm surrounded by here just so we can talk is huge, and I think that there is great value in it. Why I do both things. We want to try to have all of the advancement as possible, but then we also want to need it as little as possible. That's like the balance, Yes, fasting, minimalism for the body. We have metabolic clutter. This is bringing it in, okay? How do you get rid of metabolic clutter? We did the session on autophagy, if you're familiar with that process. Burn up the junk and get it out. Do you see this is like cleaning the house? When the house is clean, there's more space, less likely to run into stuff, is more efficient. We want to take that minimalist process, bring it into the cell so that our cells are as efficient as possible. This is how we really help life and health to spring forth in the body. Get to the root level. Fasting can help us do it. here is one example that was on my mind that I put into these slides. So hypertension, high blood pressure, okay, a huge problem. It's like half of adults in the country have elevated blood pressure. This is data from the American Heart Association, their study that I think was going, did it say 2021? 55 million people, 2021. I've seen estimates for the present day that we're heading over 60 million people, hypertension. And hypertension, if we go back to our list of diseases, hypertension is upstream of cardiovascular disease and kidney disease and so much of this. So, and hypertension deeply connected into our metabolism, and then fasting have such a profound impact on hypertension. So if we're taking hypertension, high blood pressure, something half of people, half of adults at least, struggling with, and the number of prescriptions is over 100 million prescriptions, I think the data was saying. So it's like, here is a huge issue in medicine, way upstream. And basically in the medical system, fasting nowhere in the discussion in mainstream treatment of hypertension, which just kind of blows my mind. And so I want to show you also data from the American Heart Association of this fascinating study that was published of 1,610 subjects who were treated with long-term fasting, including many patients who were hypertensive. And so they have multiple different groups in this study, is observational study, people with severe hypertension who are on medication, and then people who with hypertension who are not medicated, and then normotensive individuals, who are also fasting, and they're assessing blood pressure in all of these people. And what is so interesting, I highlighted a couple data points out of this, but I just wanted to read a little out of the methods of this, because it highlights something that I think is so important. Subjects underwent a multidisciplinary fasting program with daily intake of approximately 250 calories. They were able to have some broth and some stuff like this if they wanted, didn't have to. Weight went down, stress scores went down, okay, and the well-being index increased, okay. I did a fasting study. Check out my video. I've done a couple videos on my study I did when I was at the university. I experienced the same thing. People losing weight and people's stress level going down, people's quality of life scores in my study. Many data points that touch on this. People see fasting as intimidating, and it absolutely can be. But when you actually help people to do it like this in a multidisciplinary setting, here we're talking about even longer fasting, that people actually like it and people come back. It's amazing. Blood pressure values decreased. And the one I want to point out is specifically this highlighted one in people whose blood pressure were highest to start with, and people losing 25 points off their blood pressure in the fasting state. And then you go down into this other highlighted one. In people whose blood pressure was normal, it only dropped 3. So it's like people whose blood pressure is okay, fasting isn't making them hypotensive, because, see, fasting bringing things into balance, bringing things toward normal. People whose blood pressure is too high, it brings it toward normal, but it's not dropping people too low, where it's okay. Isn't that fascinating? Now, this is long fasting from 4 days out toward a month, which is just wild. And these is supervised by doctors. And this, is, to be clear, is not simple fasting. It's like simple fasting, what I'm doing in my space, is more like this next study that I show you, which is just on time-restricted eating, like a 16-8. So like way on the other end. And then this study is so interesting. This one, people are doing 16-8, I think at least 5 days a week, over 3 months. And I really dug into this because this study is a meta-analysis, and the studies that they were bringing in were specifically weight loss studies. And it's not like this other study where they weren't specifically studying a lot of hypertensive people. They demonstrated that, we're bringing 4 points off of the systolic blood pressure. But this is averaged across almost 700 patients. and it wasn't a hypertension study. So there is definitely a dose-response effect to fasting, absolutely. I did the hypertension talk specifically a couple months ago, where I presented some data from people who do fasting studies like this. The study I was showing from the American Heart Association was done at a center in Germany, and I was presenting some similar data in the hypertension talk from a center in California. The researcher who is leading that California study believes that all hypertension, essentially all hypertension, can be resolved through fasting in an extended space. My experience, which is focused on the shallow end of the pool, something like this, is that the effect is like this for many people. Some people have a more profound effect even with a 16-8 sort of practice, and some people don't. And it's like, so there's some amount of power to it. So when we think about minimalism in medicine, here we have two practices, a gentle practice and a very intense practice that are showing a dose-response relationship and getting into a space where we can help resolve blood pressure problems for people. So like, and here's something that doesn't really cost anything to do a simple fasting practice, 16-8, and all of a sudden, in my experience, it's about a third of people doing 16-8 have a significant clinically relevant improvement in their blood pressure. Maybe 2/3 don't. And some people, would need to turn up the intensity of that. But when we think about, okay, if 60 million people have high blood pressure, and we have hundreds of millions of prescriptions for this, and here we have many different data sets published in the American Heart Association, showing profound effects of fasting to bring healing to blood pressure. And when you think about fasting, it's just nothing. So I say, I call fasting applied nothingness. In the medical context, you could almost call it prescribed nothingness. Now, I'm just here. I'm a guy on the internet. Look at all my disclaimers. I'm not prescribing anything for someone. It's like, talk to your medical team. But I'm saying as a concept for the broader health system, how many prescriptions are written for pills and how much cost is associated with it and how much benefit? Just aren't you curious? I would say I'm curious. How much benefit could be squeezed out of a fasting process for practically no cost that would minimize the amount of things we have to do to people? If we say less is more, like here is a space where I say it is really profoundly true. Like less is more. Think how many levels this is operating just with blood pressure. Less food intake, less meals, is more space. Okay, that's the fasting space. Less medication, lower blood pressure. It's like less is much, much more. Much, much more. And then the cost, much less. And then just like I was showing with the pharmaceutical case in the beginning, where people being harmed from this dysfunctional process, okay, how many side effects are we minimizing also by minimizing the number of things? So like this is hypertension as a model for how we do it. Because if we go back to this list of all the processes that are downstream of metabolic dysfunction, look, I didn't even put hypertension on this list. Hypertension is upstream of many things on this list, especially the kidney disease and the cardiovascular disease. So if we're way upstream, it's not like we can wave any magic wand. It's not like fasting, I never say it's even easy, and this is like the barrier, like taking a pill is easy. If you come into a clinic and your blood pressure is high and you take a pill for it, you get on losartan or whatever you get on, and your blood pressure is going to be better. And that's a good thing. See, I love that, and we need things like that. But then we can step back from it, and we can say, look at the bigger picture that we have in medicine. And here we have a beautiful center in Germany that's running thousands of patients through it and documenting this huge benefit in blood pressure. And what if we started channeling some of the fire hose of resources that is going in the direction of this medical process? We stop medicalizing it and realizing there's actually healing potential in the body by doing nothing. That's what fasting is showing, you know? And I think it is so incredible. Maria's here. Hello to you. Happy to be talking about lowering blood pressure with fasting. That's one of the benefits that I'm hoping for. Yeah, it is a really good thing to talk about. You know, the big focus that I want, we look at this list, we got obesity there on number 5. I want to help anyone lose the weight that they want. Fasting, an incredible process to help do that. And then type 2 diabetes, like intimately connected with that. And so we open up some fasting space. We can burn through blood sugar as we reduce that resource in the body. Blood sugar, just see it as a resource that we're using and burning up. Now we're turning to the body fat, and then we can start accessing that. We're creating a hormonal environment. We're bringing the insulin level down, which is a blocker to the body fat. We're changing things hormonally in the body, and hormonally, a lot of blood pressure is controlled by hormones in the body. And so as we are changing that hormonal structure, we are opening up a lot of space in the body where things can change. So we say if we want things to change, okay, the way you change things in the body, you change the environment. You can change the experience that the body is happening. And, you know, that's just dialing me into this mental health, number 9. So we could talk all day. I could literally talk all day about all of these lists. But blood pressure, one that I key into because it's something that either you say someone is dealing with or we're trying not to deal with. Well, so many of these things are like that, right? The big idea of medicine to me, or what is even getting upstream of medicine, the way we help to minimize everything in medicine that'll make the true medicine much better. You know what I say? We want the actual interventions we do. We're trying to do as few things to people as possible. Like we want the things that we actually do to be razor sharp, you know, then everything is out of the way and we have clarity and we can make our interventions as effective and cost effective as possible with as few side effects as possible. So blood pressure is a thing. I'm happy to talk a lot more about it. Dose response, that's the thing that I would have to say. Some people getting a big response right away, even from little bits of fasting. Some people have to increase that fasting intensity more to get that effect. There is a subset of people who experience blood pressure get better before weight loss, and then there is another subset of people who it's once they start losing weight and getting that process going, then the blood pressure comes down more slowly. What I have to say about it is we just need a huge amount of more research in order to really tease out what is happening with all of it. And so right now we're operating in a frontier in medicine where we have literally hundreds of billions of dollars and trillions of dollars over the course of a decade going to research every highly advanced thing, which I'm not opposed to, like I've said, but we have almost nothing going to studying the basic foundational processes of the body, like how fasting interacts with our blood pressure, you know, which, what I have to say about it is to transition into here is we don't have to get overwhelmed by the healthcare system. We can have our own minimalist medicine, and this is the way to bring it down here, is we can run some experiments, and what I say, you talk with your medical team. You say, I heard an internet guy say a thing. Okay, and what do you think, right? And so the internet guy says, like, oh, we can run some experiments. Like you're working with your clinic. You see, if I am bringing in some fasting things, I have a home blood pressure monitor. You know, if someone is struggling with blood pressure, get yourself a blood pressure cuff at home. Ideally one that goes up on the arm and not a wristy one. And then learn how to use it properly so that you can get accurate readings, and then you can track it over time and see what happens. Create our own minimalist medicine, and this is the way that I say is the back door around so much of the maximalism of medicine, is that we create a culture that is supportive of minimalist medicine, doing as few things as possible, but not nothing. Like I tell people, like on that list was cancer, okay? I've been working on a talk for quite a while on fasting relationship with cancer, which is very fascinating, but there's no magic wand. I'll tell people it's not like you're going to start fasting. No one could ever get cancer. Everything in life is probabilities, and life in my assessment, as far as I can see, is not always fair. And sometimes I've thought about like, oh, I'm a big fasting person. It's like, but what if I get some cancer? It could happen. I think like, oh my gosh. I mean, we're just trying to do everything we can to tip the scales in our favor, but who knows? Like, as part of my study for the cancer talk, I've just been looking at all this data on cancer rates, and actually cancer rates are going down in older people and way up in younger people. And this is just really interesting to look into. I'm a somewhat younger person. I'm actually in the demographic of people who have colon cancer rates going way up. And so if you look at colon cancer screening guidelines, they've dropped from 50 to 45 to try to pick up more of these cancers in younger people. And so I've been, thinking through my own personal health things, like just full disclosure. If I had a cancer, I would sign up for every modern beneficial thing that we could do after thoughtfully considering it. I'll tell you my experience in medicine. I've seen people diagnosed with cancer who freak out and they leave the country. I've seen people head off to all kinds of different places, Mexico. Like when I was in medical school, I was, basically shadowing, helping in oncology clinics of this woman who got diagnosed with breast cancer and went off to some crazy place in Mexico, rubbing banana peels and lemongrass on themselves and just nothing that helped, and then ended up, in a very, very bad place. So we want to take the benefits of the system, but take it into our own minimalist processes ahead of time. And here's the thing, as we're trying to get into that space. Here's this question. Let me answer that. Does fasting reduce triglycerides? Looks like it didn't in the TRE study. It is variable, and that is kind of a complex topic. It really depends on the population that you are studying. In some cases, it certainly can, and in some cases, it's dependent on many other factors. What exactly diet people are eating, and what is the baseline health characteristics and weight and BMI of the people. So it's complicated. What I would say is that it's in the mix. It is in the mix, but hard to give a blanket statement on it. To me, minimalist medicine, fasting is at the core of it. I said earlier, fasting is minimalism for the body. And so as we bring fasting into the body, did the talk just yesterday, make fasting a part of yourself, As we are making fasting a part of ourself, meaning opening up space and clearing out the metabolic clutter, to me, as people are doing this and really making it a long-term part of the process, this is how we bring fasting into the healthcare system, It's like we're just decompressing for whatever part of it. We know how much of an impact can it make. I personally think, like I've said, say not a magic wand. It's not like it's going to just wash everything away. But I think the impact could be really big as people start to really understand it in a bigger fashion. We've been through a wave kind of where like a subculture kind of figured out like, oh, fasting is a thing. It can help people lose weight. So people say, is fasting a fad? Well, fasting was a fad or has been. There are fad-like elements online of people who have really hyped it into something that is kind of like that. But then when we pull things back, we say, well, fasting has been a practice that human beings have found value from for thousands of years. And we can dive back into deep history and see that across cultures and across millennia, people have used fasting for healing purposes and also for spiritual and mental health practices, just something people have found value from. So as we're thinking about our medical context where we're struggling with huge amounts of metabolic dysfunction, and we can also see, well, we are a culture that is out of touch in a lot of ways with the deep history of ways that human beings have lived and interacted on this planet. And fasting has been a part of so many cultures and traditions. And so I think, like, we are people just like anyone else. And, like, if we can touch back into some deep places of things that have value, you know, I think the potential of this actually to have a huge impact is huge. Like, who doesn't want to be healthy? Who doesn't want to have practices that can help with metabolic health? And so I actually think it is. But whether it can help more broadly, say, does it help you? Does it help one individual person? You know, I just know from my own self, it's been tremendously beneficial to my health process. I'm extremely grateful for it. And so we just bring it down into our own minimalist medicine. Bring the amount of fasting into your life that makes life better. Never forced, never to a way that causes stress. To me, a fasting process should be anti-stressful. It should be the type of thing that's like, oh, less to do, give the body a break. If you are feeling overwhelmed by hunger in any space, you can stop it at any point, realizing you're just strengthening, like lifting a weight. We've used that analogy of weight a lot. Like, how much hunger weight can I lift? If you say this is maxing me out, we can just stop. But then watch the hunger series that I have on the channel and then use that as a training program, because a fasting process, a powerful process to gain control over hunger, is something you can practice and get better at and master. Is an incredible skill in the midst of a consumption culture where the consumption so much is driving the dishealth and dysfunction. Fasting is a process that I say very gently can push back against that. That's bringing minimalism into this entire process. Not nothing forever, right? Maybe nothing for periods of time. But remember, minimalism is not about no possessions. It's about just the things that bring value. And so we think about fasting process. It's not about never eating. It's just about bringing context to the eating so that the eating we have is very purposeful, so that it's bringing us the healthiest things in a context that helps it to nourish the body, right? This is the type of mindset that as people adopt, it's going to have an impact. And then here's every other parts, the 4 things that I talk about. The clean eating. Remember, fasting and eating is the same thing to me. It's just one and then the other. We need both of these things, and we kind of balancing back and forth. And really our process is about finding the line between that. How many times eating is most beneficial to the body, and how much fasting time is most beneficial to the body is another personal experiment that we can run in our own life. You know, is the answer to that 3 or 2 or 1 or maybe sometimes 0 or maybe 4 in a season? You know, it's like we have this spectrum of space. And then our movement practices, these are the foundational things that are so easy to overlook, and that are overlooked in our society in great measure. Bringing gentle movement practices might be as simple as just taking a walk. No gym membership required. Body doesn't know if we walk into a gym. It just knows if we move. So doing simple movements, taking a walk, doing a stationary bike, doing some light resistance things like body weight squat means just sitting into a chair and standing up again, you know, that this is working the muscles of the body, helping them to be strong. As we're doing that, we're soaking up excess energy, and all of these things feed forward, and all of these things are the synergistic processes that help us build a holistic process of health in our life, and that help the metabolism to be finely tuned and the body to be strong and the nutrients to be there so that our energy is present. And when all of these things are happening, that's supporting our mental health practices. And we see maybe the foundation of all of it, a practice of mindfulness to keep our headspace in the healthiest way. When we are doing all these things together, it's going to give us every best chance to need as little medicine as possible. This is how we are creating the most space in our life. No guarantees, right? Life happens. Life does not seem to be fair. All kinds of things happen to people, and like we said with that story on the pills that weren't so good. Is okay, there's things happening and we don't understand all the reasons why, but we do our very best, bring all of the healthiest practices into our life to give ourselves the best shot. And then if we have done that, then from that point, that's maybe where medicine, as it's traditionally found in our culture, would start. Say, I'm doing every good thing that I possibly can. I tried my best with all this, and look, this happened. And now we can deal with it. But even when these things happen, because life happens, okay, we're at least at the strongest starting point. You know what I mean? We're giving ourselves every advantage so that medicine can take us the rest of the way, if you see what I'm saying. Some thoughts on minimalist medicine. Some thoughts on taking the very best and most powerful care of ourselves that we can, so that we can be as healthy as possible and need as little medicine as possible. That's been the thought behind it. I could probably go on and on about it for so long, but I will try to leave it perhaps at those thoughts today. I would love to hear your thoughts. Oh, look at me. I would love to hear your thoughts about it. Have an ongoing discussion about it. Are there reflections that you have about this after hearing it? Are there things that you would like to know more about? Happy to do more talks like this. I have a couple planned on these different ways that we can take these elements and bring them into our life. And then it's mirroring, these big picture things. I kind of like thinking about the big healthcare system, which is complicated and it's both beautiful and difficult. And I do love the technology, and it's very inspiring to see many of the developments of where it is going. And I think the part that we really need to add in is just trying to need all that good stuff as little as possible. And I think that's like at least half of it. At least half of it. Need as little as possible. That's what I want. I love all the high-tech scanners. It's amazing, the molecular biology and the synthetic agents that are being created, and all that is great. I just never want to have to use it. I'll tell you about it. I don't want to have to use any high-tech thing. If I absolutely have to do it, then I will do it. Okay. Share your ongoing thoughts in the comments. Come back to this session. If you have thoughts like this, come back to the video. Leave a comment. It'll come to me. We'll have an ongoing chat about it. I hope these thoughts are encouraging. I hope they bring a great mindset and thinking to you. All these things matter. What I said earlier in this session, everything matters. Our health choices in this day really do matter. So I give you the greatest encouragement. If you have a mindset to do it and you can open up some fasting space and that feels gentle and positive and you can feel the energy flowing, then I say lean into that. And if that's not your day, then beautiful. And I say, as much as you can in this day, try to keep every processed thing out of your life. Choose the healthiest, most nourishing foods. Maybe take a walk, get some exercise. And join me tomorrow. We'll dial in on a centering mindfulness space. That's what I'm planning for tomorrow. So we dial in on some of that thinking. And I will look forward to seeing you there. Have a great day, everyone.